Welcome everybody. My name is Kellie Hansen from Holistic Lifestyle Practice, and I'll be hosting tonight's webinar on lifestyle medicine and mental health. Now, before we begin, I would like to acknowledge the traditional owners of the land on which we all meet and live and work and learn today or tonight, all around Australia. I've had some amazing places that have shown interest for tonight. So really just wanted to acknowledge the land that we are meeting on tonight. I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people here tonight. So lifestyle medicine teaches us that health is shaped by the way we live, connect, nourish, rest and care for one another. These ideas have long been reflected in the knowledge systems of Aboriginal and Torres Strait Islander people whose enduring connection to country, culture, family, community, holistic wellbeing and spirit are inseparable. I acknowledge this wisdom with deep gratitude and deep respect as we begin tonight's webinar. So a little bit about myself. I'm an accredited mental health social worker, credentialed eating disorder clinician, clinical supervisor, somatic experiencing practitioner, and current Master of Lifestyle Medicine student. I've got 3 units to go, so I'm getting there. My journey to study the Master of Lifestyle Medicine began when I completed a certificate of nutritional advice. And this really started to plant some seeds in my current understanding of the link between food and mental health. And so, as I said, I've only got 3 units left to complete. I'm really happy to say that I'm finally seeing an endpoint to a lot of reading and assessments, but also the possibility for lifestyle medicine and mental health on an individual level, community level, in research and new and innovative strategies to complement traditional mental health care. I currently work in private practice at Holistic Lifestyle Practice under GP mental health care plans, eating disorder treatment plans, chronic disease management plans with NDIS participants and provide clinical supervision and training to mental health practitioners around Australia. At the moment, I work predominantly online via telehealth, and just recently in the last sort of month, a morning a fortnight in Bridgetown in Western Australia, with my amazing colleague here, Luna, the therapy dog. She has completed some training. She's 7 now, so she's very seasoned in terms of therapy work. But I do find her to be a very regulating presence in the room. Just really quickly, some upcoming group supervisions that I have available, starting Friday 17th of July, 10:30 to 12 Perth time. It's a 4 group supervision sessions with a real focus on lifestyle medicine for mental health. Big topics, staying within scope of practice, that will come up further down the track in this webinar. Also, same date, Friday 17th July, 9 to 10:30 Perth time, again online via Zoom, 4 group supervision sessions. And this is more focused on somatic work, embodied presence, and integrating the somatic work into practice. Another way to keep in touch, my website has a mailing list. You're welcome to jump on there. I try not to send out too much information. Don't want to overwhelm people's inboxes, but any relevant sort of offerings that I may have will either go through there or on Facebook or Instagram on my business page. So I think now's a really good time to pause. And I know that sounds a bit strange because we've really just started, but I think this is really important, especially at the end of the day where we've all probably had busy days. We're coming home. It's in the evening for some people over East. I just really like to invite you into a brief moment of settling. You don't need to change anything. You don't need to do anything. Just notice what's here. If it feels comfortable, let your feet make contact with the floor, or notice whatever your body has been supported, but whatever part of your body has been supported by the chair beneath you. Now gently allow your attention to widen. Notice 3 things you can see around you, 2 things you can hear, and 1 sensation within your body. Maybe it's the feeling of your feet on the floor or the temperature in the air. There's nothing you need to do right now. Nothing you need to fix. No expectations. We're simply giving the nervous system a little more information that right in this very moment, you're here, you're supported, and you're present. If it feels natural, let your next exhale be just a little longer than your inhale. Not because you have to, but because a slower exhale can gently invite the body towards that settling. As we continue, see if you can bring just a little more curiosity, some steadiness, and most importantly, kindness towards yourself into the next part of our time together. All right, so let's get back into it. The goals for this webinar. I wanted to introduce lifestyle medicine, most importantly, why it matters for mental health. We're going to explore the 6 pillars that influence mental health in lifestyle medicine, the connection between lifestyle behaviours and psychological wellbeing, practical ways to support mental health through everyday habits, and finally, how a whole person approach complements traditional mental health care. So here we have a definition from the Australasian Society of Lifestyle Medicine. So Australasian Society of Lifestyle Medicine is a health promotion charity working towards improved prevention, management, and treatment of chronic, complex, and lifestyle-related conditions, which include environmental, societal, behavioural, and other factors. And so lifestyle medicine provides an interdisciplinary whole system approach to the prevention and reversal of chronic and lifestyle-related diseases through the modification of the behavioural, social, and environmental drivers. So that's kind of what lifestyle medicine in a nutshell. I think it's a really simple explanation. But of course, when we look into it, it's so much more complex than that. And hopefully we can address some of that tonight. All right, so moving on. Why does this conversation around lifestyle medicine and mental health matter? And it's a conversation that I would love to continue in one way or another. Not quite sure how that's going to look, but I think it's a really important topic. There is a lot of research out there in terms of lifestyle behaviours and physical health. We certainly have the evidence base to follow those things up. My hope is that mental health, the research that is going into that may increase. You know, it's certainly out there, but it's growing. It's definitely growing. So why does it matter? Mental health disorders are one of the leading contributions to global burdens of disease. There are high rates of comorbidity, particularly cardiometabolic conditions. Traditional treatments such as medication psychotherapy can be effective, and I really want to acknowledge the benefit of these. And not only the benefit, for some, these things are life-saving. So I certainly don't want to downplay it or dismiss these as a treatment option, but sometimes it's just not enough. And so when we look at lifestyle factors, these are the things that are potentially modifiable. They're transdiagnostic and many times not considered in mental health support. So I have the title of a study here from Professors Kathy Francis and Amanda Johnson and Dr. Rhonda Wilson. They found over the last 30 years, there has been 55 high-profile public inquiries into mental health, which involved 55,000 public submissions, 9,000 witnesses, along with other contributions from the community. Many of these submissions and contributions were from people who actually use mental health services. And they share each time there's an inquiry, they share their personal and often traumatic experiences. Despite this, their analysis shows that key recommendation themes identified for mental health care 30 years ago remain current issues to this day. So something really needs to shift here. And again, I think this is why the conversation matters. What can we do here? So when we look at lifestyle medicine, it's most effective when practiced as an interdisciplinary model. So health is complex, as we all know, and mental health, and no single profession has all the answers. And while multidisciplinary care is valuable, it can have a tendency to be siloed. And interdisciplinary care, what this does is brings together different areas of expertise. This is the important part, in partnership with the person receiving care. And this ensures a more holistic, coordinated and meaningful approach. And as I said, I think the key term here is that it's in partnership with the person receiving care. They become part of the team. Having a person-centred approach, starting with small achievable changes, avoiding overwhelm, prioritising what matters to the person, and having a goal of these lifestyle behaviours becomes the foundation of care embedded within all mental health current traditional models, medication, psychotherapy. So it adds to it, not necessarily replacing it, but just adding to it, and not being an afterthought or just missed completely. I think that's really important as well. So Professor Gary Egger, pioneer in the lifestyle medicine realm, and his work has really helped us to understand and address the underlying causes of chronic disease, amongst many, many, many other things as well. But for this visual, this is where I think we can really begin to understand that health is just not an individual issue, but more of a hierarchy where there are diseases, risk factors, causes of those risk factors, causes of the risk factors, and causes of the causes of the causes of the risk factors. I'm glad I don't have to say that too many times. So when we go right to the cause of the cause of the cause, we start to look at things like environmental, physical, political, economic, sociocultural, adverse childhood experiences, meaningless, alienation, loss of culture and identity, just a few of those things. And then we can see what it causes, and then maybe midstream, downstream, risk factors, and then the disease. And as I said, we can certainly look at, we come in, I think a lot of the time our health system comes in at the disease, so it treats type 2 diabetes, stroke, cancer, chronic health diseases. Lifestyle medicine seeks to look back along the hierarchy, more to the upstream causes. And I think this visual, or this sort of hierarchy, really, this is where I think mental health practitioners have a real deep understanding. We're always looking for the cause of the cause of the cause. Particularly social workers, I can say that because that's my background, that's my training. But I'm going to guess, counsellors and psychologists would be, kind of similar with that as well. But yeah, really understanding those upstream causalities. But anyone have a Google of Professor Gary Egger, and you can have a look at his work in the lifestyle medicine realm. All right. So we've got the 6 pillars of lifestyle medicine. And what we're going to do is go through each pillar. I'm going to encourage you to do some reflecting as we go through each pillar. Don't need to say anything. You can write it down if you like, or just in your phone or on some paper, or just, have a think about what these terms mean to you. All right. So I tend to go over the 6 pillars. To me, that sort of seems to be the one that I see the most. I have seen models where there's 7 or even 10 pillars. But just for tonight, we're going to focus on these 6 pillars. What I do want to kind of acknowledge, though, that this is not a full list. And we are looking also, well, I think also considering things like connection to self, embodiment, gratitude, self-efficacy, connection to purpose, meaning, values, spirituality, connection to nature, country, those green and blue spaces, connection to culture, identity. Do people feel safe? Can they practice their cultural practices, relationship, environment, work, sexual health? It's a big, big kind of topic. So we're going to focus on these 6 ones. And as I said, this is going to be time for you guys to do some reflecting. So restorative sleep is pillar number 1. And just take a moment just to have a think. What comes to mind when you think about restorative sleep and mental health? I'll just give you a few seconds to have a think about that. All right, so we know that sleep quality and quantity is declining. We can really trace this back to the introduction of electrical lighting and industrialisation, which this really began to alter our timing and duration of sleep habits. And relatively in the human lifespan, it's been, not that long ago. But more recently, things like changing work habits, lifestyle drivers, undiagnosed sleep disorders, night shift, social media, those high stimulation apps like TikTok, have impacted sleep even more. There's quite a bit of research coming out of the United States. So the CDC there has done quite a lot of rigorous research in this area. They found around 38% of adults have inadequate amounts of sleep. And in Australia, the Sleep Health Foundation in 2016 did some surveys. They found that self-reported inadequate sleep affected around 33 to 45% of Australian adults. That's a lot. So I think it's a fair kind of point that this is probably why it's one of the pillars, I would imagine. That's how important sleep is, but how less the quality and quantity is certainly reducing. So just wanted to give, a few tips, and these are very general. Sleep hygiene. We want to create a consistent rhythm, go to sleep and wake up at similar times. Try to use light, outside light to guide your body clock. I like to get outside first thing in the morning. I often have breakfast, in the sun. Again, in the evening, I'll be outside just as the sun goes down. It kind of really replicates either what the body needs, that morning sun and evening sun. Practicing the nervous system transition to rest, maybe turning the TV off before, a couple of hours before you go to bed, putting down your phone, whatever it might be. The bedroom is a sanctuary. Being mindful of stimulants, moving your body during the day, good nourishment, because we know that sleep and metabolism is quite connected. Sometimes, people will talk about having that personal evening ritual. That's a very broad tips, but if you're really concerned about your sleep, I suggest speak to your GP, allied health provider. The Sleep Health Foundation also has some really good resources. All right. We'll move on to the next pillar, reducing risky substances. And I like to, just going to move that way. I like to, I don't know if it's a me thing, but I've seen it. So I thought, yeah, that makes a lot of sense. I like to put tech time in reducing risky substances. So my question for reflection for you guys, what comes to mind when you think about reducing risky substances and mental health? So, current and past health messages are predominantly focused on fear and shock based tactics to get people to stop a certain behaviour. And I'm definitely not criticising these strategies. There's, I'm guessing, quite a bit of evidence base around the theory and the models around these things. But we do know behaviour change is way more complex than just telling people to stop. A trauma-informed approach, which this is, I guess, the approach that I have, would really start looking at these behaviours and ask, what need is the behaviour trying to meet? And also understands that when we remove a coping strategy before building emotional regulation skills and successful new strategies, that's really needed. And this includes tech time, particularly for adolescents. For many, this is how they socialise and engage in the world. And while there is definitely growing research and evidence around the impact this has on the growing brain, adult brains as well, and the benefits for socialising in person, we'll talk about social connection a little bit later. And a number of other factors, we still need to understand the behaviour, help build curiosity for the person as to why this is occurring, and other meaningful, enriching opportunities in their lives to help reduce the tech time. It's a tricky area, though. It's tricky and it's complex, and it's very simple for me to say all this, but I think it is an important factor, though, that trauma-informed approach to particularly this pillar. I think it's important that we consider the full picture here. So as I said, just, sort of saying to someone, you need to stop, it just may not be effective, but we want to start supporting them to understand what the substance does for them and then building safer ways to get those needs met. So rather than asking, how do I stop? Seeking to understand the purpose and finally, how do I stop? And then finally, choices. This is another angle. Are my risky substance choices supporting or aligning with the life and the health that I want to have? Like before, if you're concerned about your substance use, please speak to your GP, allied health provider, or the Australian Alcohol and Drug Line support for individualised support. All right. So moving on to movement and mental health. And I'm wondering what comes to mind when you think about movement and mental health. Now, I'm not sure about you guys, but whenever I think of movement, I'm reminded of the beliefs I held around exercise growing up. High intensity aerobics with leotards and leg warmers, and yes, I'm showing my age here. Running, sweaty, breathlessness, pain, injury, weight loss, clothing size. They're the things that I guess my brain had coupled with exercise or movement. The goal for me was to uncouple that, and because that's not really appealing to me. I don't want to do all those uncomfortable, breathless, painful, sweaty kind of things. So when I changed exercise to joyful movement, something shifted. It helped me learn to listen more intuitively to how I need to move to feel those benefits. There is more rhythm to how I move. Some days it's gardening, some days it's stretching, some days it's the gym, sometimes it's putting, music on and dancing at home. I can really intuitively tap in now to what I need, and definitely have a different mindset and attitude to this important pillar of lifestyle medicine. So we have known for quite some time about the benefits of movement on physical health. There is now growing evidence on the importance of it for mental health. This is a research quite recent. I think it was 25, and I think it was Australian as well, if not the first author. So this research actually found walking, jogging, yoga and strength training to be the most effective treatment for depression. And yoga and strength training were the two that seemed to be the most tolerated as well, where people could continue long term. So joyful movement, not exercise. I won't use that word. So joyful movement tips. Just like I was talking about before, finding movement activities that you enjoy. We want to shift that focus from weight loss to well-being. There's the whole health at every size. When you focus on weight loss, I don't know if that's like the best way forward for majority of people. So focusing on well-being. Start small, build up from there. Great to move outside, fresh air, sunshine. Also great to move with other people. Again, listen to your body. Movement is medicine, it's not a punishment. So GP, allied health practitioner can support you in taking those first steps, changing your mindset and exploring what makes movement joyful for you. Speaking of movement, now's a good time for us to move. So you can either stand up, have a bit of a stretch, shake your body, drink some water, or all of the above. Just going to give it a little bit of time just for a little bit of movement. Okay, so moving on now to social connection. What comes to mind when you think about social connection and mental health? So the World Health Organization released a landmark study in 2025, which focused on social isolation and loneliness being a major public health challenge. They found social connection to be essential to the health, strength, and resilience of individuals and communities. Possibly not new information, but definitely becoming more evidence-based, and nonetheless very very important. And it has supported this concept of social prescribing as an important and necessary component of health and wellbeing. So the Australian Disease Management Association actually has a social prescribing hub. There's tools and resources amongst other things as well but there's some things on there that are free available. But if you do a bit of Googling for social prescribing, there will be quite a bit of info online about that as well. So sometimes people think, oh, I've got to go and, I don't know, get a hobby, join a club, go meet with people. And yeah, I mean, that's important. Um, Sometimes we've got to push through and do those hard things to get the rewards at the end, but not always. Sometimes, it can be more about experiencing those quality relationships where you can really be yourself, feel safe to be authentic, and just know that you matter. And we don't always need a big group to find that. But I always say start making a connection part of your routine. If it's a weekly phone call to a friend, or when you're hopefully out there doing a little bit of walking in some green spaces, it's a hello to the person that you might see a few times a week. Sometimes it's connecting with others through shared interests. Being present, put your phone down when you're with others. Sometimes that can be a distraction. So really being present when connecting with others. Go slowly, build up over time, but still push out of your comfort zone a little bit. Like I said, it can be hard. I think COVID, I mean, I don't know if there's any research, there probably is, but COVID changed the way we socialize. And it's really important for us to push through sometimes the discomfort that can come with social connection. So moving on to the next pillar, what comes to mind when you think about nutrition and mental health? Before we have a look a little bit further into this, I'd really like to reframe the term nutrition, especially in the context of rising rates of eating disorders within diet culture and body image concerns. Just like the exercise becomes joyful movement, maybe it's something like eating for well-being, joyful eating, intuitive eating, fueling up, eating a rainbow, embodied nourishment. I just think it's really important for us to, I guess, acknowledge the risks around dieting, which is not what we want to do in lifestyle medicine. But for some people, that's where, when you think of nutrition, often, this is my clinical experience, there's good, bad foods, healthy, unhealthy. There's 50 million diets we can go on. I could talk about this topic for a long time, but I think in lifestyle medicine, it's super important not to get too prescriptive and too caught up in, well, not caught up at all in good, bad foods. I think food needs to be neutral. Food is neutral. There's nutrients and everything out there. The goal is to make food fun, nourishing, delicious, spices, flavors, smells, eat socially, all those things I think really need to take precedence over, should I be eating that, chocolate bar, or, should I be eating more, I think it's just something for us to consider. Having said that, we are super lucky here in Australia to have the world leading food and mood centre located at Deakin University. It's led by the amazing Professor Felice Jacka and a team of researchers. I could listen to her talk forever. They study food and mood at various levels, from microbiology to public health and in between. So the Food and Mood Centre is a research centre that aims to really understand the complex way in which we eat, in which the way we eat influences our brain, mood, and mental health. So in 2010, there were some initial studies done on food and Mood by Professor Jacker, but these were more observational studies and not overly rigorous. So in 2017, so we're talking about less than 10 years ago, Professor Jacker and a team published the SMILES trial. This was a lot more rigorous, randomized controlled trial. When you listen to her talking about it, she will actually say there were quite a few of her peers telling her, not suitable, it's a ridiculous idea, laughed at, think about something else. Nonetheless, she persisted, and with her successful publication of the SMILES trial, there was worldwide attention, and that helped the Food and Mood Centre grow. And since then, countless research has been done to add to the growing body of evidence. So for anyone with an interest of food and mood, this is a great starting point. They do have online courses. They also do have a free 3-week course called Food and Mood, Improving Mental Health Through Diet and Nutrition. So this was developed by the Deakin Food and Mood Centre, delivered by Dr. Tatiana Rox and Professor Felice Jacker. So I do, if this is an interest for you guys, I do say have a look at the Food and Mood Centre. Right. So we're going okay for time. The last pillar is stress reduction. What comes to mind when you think about stress reduction and mental health? Now, this is one way to look at stress, and we can kind of divide things up into those big stresses: bereavement, relationship breakdown, serious illness or injury, financial hardship. Sometimes these, we can't escape them, they happen. You might sort of, have childhood stresses that, the adverse childhood experiences, all those things, we're kind of stuck with those. But if we move to the other side, the micro stress doses, or the MSDs, I found this is a really helpful way to conceptualize this idea. If you imagine a normal morning, you wake up to the alarm clock and you're just a bit tired because you stayed up a bit late last night. There's MSD1. You roll over and grab your phone and log into Facebook, and an invitation to go to an event you feel obliged to go pops up. You don't really want to, but you're going to have to. MSD2. You switch over to the news tab and read about an escalation in current war and petrol prices, very relevant. MSD3. You haven't even got out of bed yet, and there's 3 of the MSDs. So then you get out of bed and realise, I forgot to hang out my washing last night, and now your work clothes are wet for the day, so you have to get them in the dryer. MSD4. You yell out to your teenager, come on, get out of bed, you've got to get ready for school, and they yell back at you. MSD5. So there's 5 MSDs in the first few minutes of waking up. And of course, we can't go through life with none, but we can certainly learn to manage them better and recognise just how much, through constant phone notifications, checking emails, running late, skipping meals, traffic, comparing yourself on social media, lots of background noise, having too many tabs open, literally and mentally, are all the things we do have some control over those things. So moving on to some stress reduction tips. This was a tricky one because often when we think about stress reduction, for me anyway, we might consider things like mindfulness, meditation, relaxation. Let's take a week off work. Let's try increasing movement. These are all great strategies. But when we actually look at the different types of stress, we have psychological stress, emotional stress, dietary stress, physical stress, technological stress, life stress. There's probably lots more. We kind of know, unless we really know where the micro stress is coming from, it's hard to target them. So I guess for this one, this is where the 6 pillars can support all of those in different ways, to almost lay a foundation. And then we can really start, having a look. Is it technological stress? Am I on tech, way too much? Let's focus on that. Is it dietary stress? Do I have a very high processed diet without a lot of whole foods? That can stress the body, metabolism, nervous system. So, yep, let's focus on that. So I think understanding whether, firstly, is it a big stress? Is it micro stress? That can be the starting point of really personalising stress reduction for people. Oh, and the last thing of that too, this is where we can really start conceptualizing how interconnected these pillars are. And what I mean by that is when we start focusing on one, sometimes it positively impacts others and increases those lifestyle behaviours. So, for example, I'm really going to focus on my sleep. What I notice is that I wake up much more refreshed. I'm more likely to take a walk before work or even after work. And then suddenly the movement pillar is rising, and then I'm feeling a little bit better. So I'm going to go out with friends, on the weekend and catch up with them. So it's interesting how one can connect to the next, to the next, to the next. But that is part of the important part. If we say, let's address them all at once, overwhelming. So it's about a gradual work towards these pillars. Right. Well, thank you for sticking around. That's a lot of information, I know, in a very short amount of time. So when I thought of this webinar, I did sort of ask around, and I wanted to know, were there any sort of questions? And as I said, we don't have time for them tonight, but there was 2 questions that came up. And I just wanted to quickly run through those. I'm speaking from a social work perspective, and I do know this will overlap counsellors and psychologists and mental health nurses, mental health OTs to some degree. But this is purely from my knowledge around social work. So the first question, how is a social worker able to practice lifestyle medicine? And it's an important question. And the quickest answer I have to that is it is possible, as long as you stay within your scope of practice and have some training. And you don't necessarily need to go full on into it like me and do a master's, but there are plenty of opportunities to become lifestyle medicine informed. But here would be my long answer to that. So lifestyle medicine is more than just about behaviour change. It is about us understanding the whole person. This is how social workers are trained and is generally part of our daily practice. Social workers understand that health doesn't happen in isolation. We have a deep understanding of people's context, including relationships, the environment, communities, and society. Social workers are skilled in behaviour change. Many have expertise in motivational interviewing, goal setting, psychoeducation, collaborative practice, and strength-based care. Social workers also understand that many health behaviours are adaptations of trauma, adversity, and stress. And we bring a trauma-informed lens to each person and really understand that change happens best when there's safety, compassion, and connection. Social workers, I continue, still are skilled in understanding social determinants of health, housing, education, income. We understand that, access to fresh food is not available to everybody. There's not access to green and blue spaces, not access to healthcare. There may be, challenges with health literacy. So we have a deep understanding that health behaviours are shaped by much, much more than individual choice. Social workers are trained and love to connect systems and people through their interdisciplinary care. Finally, I'm a big believer that lifestyle medicine should be available to everyone, and social workers are really well placed to push for health equity by challenging barriers and advocating for fair access to health and wellbeing care and support, along with finding innovative and creative models of care. And like I said, I can't speak for other mental health practitioners, but knowing some amazing and highly skilled colleagues, psychologists, counsellors, mental health nurses, mental health OTs, I would say that, you know, a lot, if not all, would apply in some way to them also. And having a look at this final slide, the other question that came up a little bit before this webinar was how would I work with a client? So I've kind of framed this visual to firstly help myself conceptualize it. And it's not unlike how I normally would start. We've got the assessment phase over on the right. So we're looking at a biopsychosocial assessment. We're gathering information to understand the whole person, looking at social determinants of health. With my background in trauma and eating disorders, this would be part of the assessment phase. An example of this. So if somebody came in, you know, perhaps with anxiety, they also tell me they've had a long history of dieting. There's heavily ingrained diet culture language. There's body image concerns. I would consider doing an eating disorder examination questionnaire, an EDEQ, which is a 28-item self-report tool. I just want to be sure that we're not looking at an undiagnosed eating disorder, for example, binge eating disorder, layered with years and years of shame for not being able to, inverted commas, stick to diets, know what they're, inverted commas again, supposed to eat, inverted commas again, failing around food choices. So I really want to unpack that, particularly if we're going to delve into the nutrition pillar. And I certainly don't want to be doing behaviour change with somebody with an undiagnosed eating disorder. This assessment phase 2, when it comes to lifestyle medicine, is, you know, potentially asking a client to see their GP for a blood test to rule out any nutritional deficiencies. For example, the client presents with depression and fatigue. Potentially they've got undiagnosed low iron. However, my scope of practice would absolutely not be to interpret those results. I happily leave that to the GP or other appropriate allied health practitioner. But now that we know this, we'll definitely be supporting the client to make any changes that have been recommended. This term has not come up on the webinar yet, but I wanted to pop this in here for you guys to maybe have a bit of a Google, but shared medical appointments can be a fantastic way to offer interdisciplinary care. Like I said, not going into it tonight, but I wanted to just pop that term in here for you guys to be able to have a look at. So moving on to case formulation. I'm always looking for the why in lifestyle behaviours, with the understanding that it is not always an individual choice and people do the best with what they have at the time. Case formulation is also important time for collaboration with the client. I might have a client come in and, you know, they're drinking a bottle of wine a night, and I might go, that's the problem. I want them to start to reduce that. If I collaborate with the client, that may not be where they want to start. So I really want to start where they want to start. And if you're lucky enough to have other practitioners around you to collaborate with through interdisciplinary care, this is amazing, because the team approach, which includes the client, is great for better outcomes. So we'll move on to interventions. Again, scope of practice. I think I've underlined, yes, I have underlined that in the visual there. It's super important. There's probably no, well, yeah. There's no clear framework. There's no like rules anywhere where it says that you can't do that, but there is, you know, social workers have a code of ethics, mental health practice standards. So it's there, but it's not overly clear. So I think this is a super important term to, you know, keep coming back to, and I certainly do in my practice. But some of the interventions may be, you know, health coaching, motivational interviewing, goal setting, psychoeducation. That would be the lifestyle, I guess, area. Then we've got, you know, your focused psychological strategies, EMDR, CBT, mindfulness, relaxation. So it's a combination of things. And finally, this is a big part of this too, is referrals. Again, scope of practice. When you're outside, when I'm outside of my scope of practice, I want to know, I want to make sure I've got a good referral system happening. Part of this too is you can refer, if it's out of your scope of practice, say they want some nutritional advice, you can refer them to evidence-based information that they can find online. For example, the Australian Dietary Guidelines, it's the best we've got, but it's, you know, it's okay. It's okay to refer clients to that. Sometimes I will talk about the Smiles trial, which is essentially Mediterranean low processed kind of food that was in there. But often it is, okay, you want to focus on nutrition, let's get you a accredited dietitian to you know, collaborate with us. Yeah, I think the collaboration again is the key word for that one. So, but going okay for time, we're almost there. I love to have people reflect on things. So, for any practitioners here, some things that you might want to think about. Has anything challenged my thinking tonight around lifestyle, medicine, and mental health? How do I create safety before behaviour change with clients? What aspects of lifestyle medicine sit comfortably or uncomfortably within my scope of practice? What pillars are easy or not easy to integrate into my practice? And what barriers do my clients face to lifestyle behaviour change? And for anyone else, you know, maybe not in the field, but have an interest in lifestyle medicine and mental health, what is one area that stood out for me in this webinar? Sorry, practitioners can do this as well. What is one small step I can take toward the 6 pillars? How can I approach myself with more kindness and compassion this week? Which lifestyle habits feel easiest to begin? What support might I need to succeed? And what daily habits help you to feel your best? So where to from here? So I am available for counselling by telehealth Monday to Thursday in Bridgetown every second Friday morning. Clinical supervision again Monday to Thursday, Bridgetown every second Friday morning. I will be holding some more free and paid webinars throughout the year. So connect with me, Holistic Lifestyle Practice on Facebook and Instagram. I'm on LinkedIn. You can subscribe. I wanted to leave you all with a couple of places to go looking for more information. So as I said, Australasian Society of Lifestyle Medicine have some online courses. I don't know the cost. I don't know if there's any free info. I think there is free info. I don't know the cost though. The Food and Mood Centre definitely has courses and has the free food and mental health course. Lifestyle medicine podcasts. I love the GP show. It's Australian. It's run by Sam Manger, who is the coordinator, I think I got that right, at James Cook University, who has the grad cert, grad dip and masters of lifestyle medicine. Southern Cross University also has the grad dip a grad cert, grad dip and masters. The lifestyle medics, I like them as well. But they're just two podcasts that I've really enjoy listening to, and I just wanted to make sure you guys had those as well. So 5:58, within 2 minutes, we made it. So thank you all for spending the last hour with me on this lifestyle medicine and mental health journey, because it is a journey. This webinar will be uploaded and made available hopefully within a couple of days. So please do share with anyone who may be interested, and have a great evening. See you later.